Howdy everyone, Matt and Mateo here, coming at you with another orthopedic special test, and this one is for the shoulder. It is the bear hug test.
As it's clear to see, man and beast have a special bond.
This test came from a paper in 2006, so it is a more recent one. And it was developed by researchers who wanted to come up with a better test to diagnose lesions or tears in the subscapularis. Because they were saying that the current tests, like the lift-off test or the belly press test, only activated certain fibers in the subscapularis. We were saying that the lift-off gets more activation of the lower scap, whereas the belly-off gets more of the upper fibers. And they said, we want one that will hit more of those fibers to be a little bit more accurate. But anyway, let's get in on how to do it. To perform this test, you have the person either sitting or standing, either one that they would like to do. What you're going to do is just ask them to reach across to grab the other shoulder. Now, don't ask them to actually hold their shoulder because you're going to have to move their arm here, but have them like, hey, put your arm on your other shoulder. Don't have them actually grab it. With the shoulder there, you grasp the forearm, and then you're going to apply a force perpendicular to the forearm. So you're trying to lift off the arm this way. So you're trying to lift them up like that, so they are resisting an internal rotation. And a positive is either that they cannot hold that position, or it is 20% less than the non-involved side. In getting in on the research for this paper, there's actually a lot out there. So that original paper back in 2006, the authors were comparing this test to the belly-off, lift-off, and Napoleon test. And they said, we want to see which one of these four are better. And they found that the bear hug has a sensitivity of 60%, a specificity of 91.7%, and an accuracy of 82.4%. So they found it was better than those other tests. Now, you remember what I said earlier about the authors wanted to come up with a test because like the lift off and the belly off only looked at certain fibers. And well, these researchers in 2007 wanted to see, does the position of the arm, so being up or down, does that affect the number of fibers involved? So they tested this with 0, 45, and 90 degrees of shoulder flexion. And they found you get better activation of the upper and lower fibers at 45 degrees of flexion, whereas with the 90 degrees, you get more of those lower fibers. So that was pretty interesting. Now again, there's been some other stuff. So that they found that this test actually in 2008 was pretty sensitive for detecting small tears. So there was that paper in 2008. They said it could detect a tear up to about 30%. So a 30% tear. So they said, wow, this is pretty good. Now you're saying, well, Matt, that's cool. That's pushing almost 20 years of these tests. But actually, they've done it again in 2024, and they compared this to the belly off, and they looked at like 866 people, so a whole lot of people. Now, it kind of went back and forth between the two tests when they found that the this bear hug was more sensitive, so at 43.1% compared to 23%, but the belly press was more specific at 93 compared to 83, so a little bit more specific there. But overall, the bear hug was more accurate, 54.5% compared to 39.5. So very interesting test. I've actually just started using it a little bit more. Had some strange shoulder pain coming in, and I've used it on a few people and kind of found some positives in there. Anyway, there is the bear hug test. What do you think about it? Have you ever heard of it? Do you use it? Do you like it? Share with us down in the comments below. Let us know all about it. Of course, if you enjoy these videos, please hit that like button. Thank you so much to everyone who has. Thank you so much for tuning in for these. This is always kind of fun. But anyway, now, let me tell you what always says. Take care of yourself. Take care of your patients. We'll see you next time.